in the east. Meningitis belt experiences seasonal outbreaks during the dry and hot weather conditions, often referred to as the meningitis season. In Ghana, this meningitis season extends over the Harmattan months from October up to March. Mr. Speaker, it is worth noting the following, which informs the response to the meningitis outbreak. There are a number of organisms that may cause meningitis, including virus, bacteria, etc. Some of these can be prevented by vaccination. In Ghana, two main types of pathogens cause outbreaks: Neisseria and Streptococcus. Based on the type of Neisseria, the population can be vaccinated. However, vaccination does not apply to Streptococcus, which is the strain currently causing havoc in the Upper West region. This means that currently vaccination is not one of the measures we can use to control the ongoing outbreak. It is worth noting, Mr. Speaker, that Streptococcus is very fatal and usually starts early in the meningitis season, only to be followed by Neisseria, which is less fatal but spread wider and responds to vaccination. Mr. Speaker, I must put on record that the current meningitis outbreak in the Upper West region is rightly a cause of serious concern. This concern is not just because of the current outbreak, but because the Upper West region has consistently recorded high numbers of meningitis cases during the dry season in recent years. Mr. Speaker, in the current season, as of Sunday, 16 February, we had recorded over 129 cases and unfortunately 16 deaths, while 29 people are currently on admission. The districts most affected, Mr. Speaker, are Wa Municipal, Nandoli, Wa West, Drapa, and Nandom. Mr. Speaker, despite the substantial number of cases and unfortunate deaths, I wish to assure the House and the good people of Ghana that we have made considerable efforts to keep the outbreak under control. Our efforts are paying off, Mr. Speaker. Already, a wave of improvement is evident in the Upper West region, where new meningitis cases are decreasing. This positive change follows the Ministry of Health's swift and decisive actions, which included deploying experts to support local teams, conducting a high-level visit to assess the situation and providing support, and ensuring free treatment for all affected individuals. We also activated the Emergency Operations Center for coordinated response efforts and engaged in consultations with international experts. The mobilization of essential antibiotics and targeted public awareness campaign have further boosted our efforts controlling the outbreak. Mr. Speaker, please permit me to highlight some of the specific measures by the Ministry of Health and its partners in response to the meningitis outbreak. Deployment of experts. We have dispatched a team of experts from the national level to support the regional and district health teams in managing the outbreak. Free treatment. We have exempted all individuals affected by meningitis from paying for treatment, ensuring that everyone has access to the care they need. Emergency Operations Center. We have activated the Emergency Operations Center at the national and the regional levels to coordinate the response efforts. Coordination meetings. We are holding weekly coordination meetings with meningitis experts from the World Health Organization to ensure that our response is aligned with international best practice. Mobilization of antibiotics. We have mobilized additional antibiotics to support the regional medical stores, while ICG has also approved 10,000 vials of ceftriaxone, the antibiotics used in treating meningitis, to ensure that there is no shortage of essential medicines. Public awareness. We have launched intensive public education campaigns to raise awareness about the signs and symptoms of meningitis, and encourage early reporting to health facilities. Community engagement. We have engaged with the community leaders and opinion leaders to solicit their support in raising awareness and encouraging community participation in the response. High-level visit. The minister responsible for health, myself, and the Director General of the Ghana Health Service have conducted a high-level visit to the affected communities to assess the situation and provide support. International assistance. We have also secured technical assistance from the WHO through delegation of an expert to help us improve our management of meningitis outbreak in the Upper West. Human metapneumovirus. Mr. Speaker, we have also identified a single case of human metapneumovirus, HMPV, in the country. Human metapneumovirus, HMPV, is a respiratory virus that can cause a range of respiratory illness from mild cold-like symptoms to severe pneumonia. While it can affect people of all ages, it is most commonly seen in young children, older adults, and those with weakened immune system. In response to recent increase in respiratory cases in China and some temperate countries in December 2024, as part of our routine surveillance, we commenced testing for human metapneumovirus HMPV this year in January 2025. So far, a total of 90 samples have been selected for testing, and only one positive case has been detected for HMPV. This was detected from an elderly person. Mr. Speaker, I want to assure the House that the risk of HMPV in Ghana remains low. As you can see, we have a robust surveillance system in place to monitor for respiratory viruses, including HMPV. In fact, these systems have been strengthened in recent years, particularly following the COVID-19 pandemic. We therefore assure the country that any case of HMPV will be quickly identified and managed to prevent the spread. Mr. Speaker, the Ministry of Health is fully committed to working with our partners to control these ongoing outbreaks and to protect the health of all Ghanaians. We have implemented a range of measures to address these challenges, including strengthening surveillance to detect and track cases, providing timely and effective treatment to those affected, raising public awareness about prevention and control measures, collaborating with local and international partners to coordinate our response. In addition to these technical interventions, in line with the aspirations of His Excellency John Dramani Mahama's government, I would like to emphasize that effective control of this outbreak is of utmost importance to my office. It is for this reason that in the past week alone, I joined health workers at health facilities and in communities to better appreciate the issues on the ground in order to provide more informed support. Mr. Speaker, together with my team, we have been to the following places: Upper West, Meningitis Response, the Regional Health Directorate, Warnas Palace, Nadoli District Hospital, Queens of Peace SHS, War Regional Hospital, and then in Greater Accra for the cholera response, Mamprobi Hospital, Matters of Uganda School, Winneba Municipal Hospital, Winneba Township, Winneba Beachfront, Swadro Municipal Hospital. Mr. Speaker, at this juncture, I would like to encourage all health workers, especially those in the hard-hit districts, to support the ongoing response to the outbreak. Similarly, I would like to call on the municipal district assemblies, including local authorities responsible for water, sanitation, and food safety, to actively play their part in enforcing local bylaws, ensuring access to safe water and food, and supporting awareness creation. In addition, I also appeal to our friends in the media to support the public education and awareness some more to fully prevent any further spread of these outbreaks. Mr. Speaker, as I end, permit permit me to call on my fellow members of Parliament to support the local authorities and health workers to educate on our fellow countrymen and women on how to prevent these diseases and the important need to report early to the health facilities when they have symptoms suggestive of any of these diseases. This helps to prevent further spread and complications, including unfortunate loss of lives. Mr. Speaker, finally, I want to reassure the House that we are doing everything in our power to contain these outbreaks and safeguard the health of our nation. We will continue to monitor the situation closely and provide regular updates to the House and the public. Mr. Speaker, before I end, let me use this opportunity to acknowledge some of the assistance and donations some honorable members have also made in this direction. Mr. Speaker, the Right Honorable Speaker has made significant donations to the Upper West region in the fight against meningitis. Equally, Mr. Speaker, the Minority Leader, Honorable Afeyo Makin, has also contributed to the fight against cholera in Efutu. Thank you so very much for the opportunity, Mr. Speaker.
Honorable members, that is the briefing statement by the Honorable Minister responsible for health. Honorable members, I will open the floor for comment, but let me remind ourselves about Standing Order 91, 3, and 4. Honorable Member for Honorable Curtis, Dr. Curtis Nawani.
Thank you very much, the Right Honorable Speaker. My name is Mark Curtis Nawani. Right Honorable Speaker, mine is a question to the Minister of Health related to okay, Right Honorable Speaker, I want to acknowledge the very good work that the Minister of Health has done. The presentation is, complete and very good. In fact, he has detailed all the steps that have been taken to fight these two situations, one at the coastal area and then the other at the northern part of the country. And all throughout, we still see that if you take cholera, for example, year on upon year, we still have cholera coming. Practically every year, we have an outbreak of cholera. The only time that I still remember we did not get cholera was when we had COVID. When we had COVID, we did not get cholera that year. And that probably should give us some information. And that is, when we had COVID, we started this hand washing. Our environment was very, very clean. And so we did not get this outbreak of cholera during that year. And so I advise the Minister of Health to collaborate with the other ministries, like local government, like environment, sanitation, and technology, to collaborate with them such that we bring back this age-old, we call them tangas, or sanitary inspectors. I don't remember those who might be as old as I am, but they used to come to our houses, and when your house is not clean, they can take you to court, or they can arrest you. We should bring them back. Sanitary inspectors, they are products of the School of Hygiene, and I believe that this is the time to bring a number of them and create employment for the youth of this country. And so we should do something of the sort to ensure that we keep our environment very, very clean. Apart from that, Honorable Minister, I don't know, but with meningitis, we should be very, very careful, because there can be what we call nosocomial infections. That is, infection of those who are also working at the hospital. That is the staff, the nurses, and then the doctors. So they need a lot of protection. They themselves need to take very good care of themselves, and we'll make sure that we don't get the people who are taking care of the sick falling sick themselves and reducing the workforce. Thank you, Mr. Speaker, for the opportunity, and thank you, Minister, for your good presentation.
Thank you, Dr. Nawani. Honorable Dr. Samuel.
Thank you, Mr. Speaker, and thanks to the Honorable Minister for Health for his response to the three issues that was raised by members on the floor. Mr. Speaker, as we appreciate the Honorable Minister, we also want to see some trends, especially when it comes to the meningitis. I realized he talked about 100 plus issues, 16 deaths that have been recorded, and 20 plus patients that are hospitalized. So we don't know whether the number of deaths is going to increase by the end of the meningitis period. We raised this issue of the meningitis belt, and Ghana, where we are placed, we are not going to be away. So we want to see more robust approach as to how this meningitis issue will be covered. The honorable member that just spoke had talked about other ministries. I had noted here the multi-sectorial approach. If you look at what the NPP government did during the COVID time, it brought various ministries together to have a task force. And if we are dealing with cholera, which we know that is as a result of sanitation and water issues, we would have expected to see more of an approach which is bringing in the Ministry of Works, Housing and Water, the Ministry of Education. Then, of course, we have Environment, EPA. We know EPA deals with some approvals and how our environment is being taken care of. So we want to see from the Honorable Minister of Health to have a very strong interministerial committee, as was put up by the NPP government during its time when we had the issue of COVID. This will be a better approach, we believe. It can help us. And in addition, Honorable Speaker, we realize that we have a huge private sector health providers, and most people tend to benefit or go to the private sector, about 52%. But how are we incorporating the private sector in our approach in terms of carrying this issue in terms of cholera, meningitis, and MVP? So we want to also see how best the private sector will be brought in. Then maybe this one I want to bring in. We have a huge backlog of health professionals staying at home. As a pharmacist by myself, we have a huge amount of backlog of health professionals staying at home, and majority of them were employed by the just gone government. We wanted to see how best we can bring in all these health professionals so we don't get them to stay home. Especially, Mr. Speaker, when you are treating this issue, you tend to have pharmacists or pharmacy technicians that are supposed to help you administer this medication. Then we have a huge backlog of pharmacists that are staying home and have not been brought on, and there are processes that the outgone government was bringing them on board. So you want to see that the minister can also take into consideration this issue. Thank you, Mr. Speaker.
Thank you very much. Honorable member will open the floor and at least take about 4 each. But before doing that, permit me to acknowledge the presence of our pupils from Nima cluster of schools. Nima cluster of schools. We don't do that. Our revered children, we don't do that. They are led by Portia Ajankra, the Municipal Director of NCCE. They are from Ayawaso East, and the total number is 258. I believe the Member of Parliament is here. Honorable Member, the second school is Life Seed Montessori School, led by Evelyn Brustego, headmistress of the school. They are from Okaikwe North, 69 in numbers. You are welcome, and may you have a fruitful visit to Parliament of Ghana. Honorable Dr. Sandari, you have the floor.
Thank you very much, Mr. Speaker, for the opportunity. I was one of those who made a statement, especially on meningitis, and you gave the directive for the minister to come before the House. And I will say that I'm very grateful, and indeed, very, very grateful to the Honorable Minister for Health for the swift response and measures taken to control these diseases. I mean, I see the situation as a test case for him, but he has demonstrated the capacity to deliver. I mean, responding to 3 major infectious diseases within a week is very commendable. So I thank the Minister for Health and his technical team for the response to cholera, meningitis, and the HMPV. Mr. Speaker, listening to the to the Minister, there is hope re-emerging. I mean, he has demonstrated the standards of practice, international standards, when it comes to response to emergencies like these outbreaks, both cholera, meningitis, and the HMPV. Mr. Speaker, what we need, and like he clearly demonstrated, is multi-sectorial approach when it comes to outbreaks. And therefore, all the other sectors must come on board, must bring their support to ensure that these diseases are controlled. I also want to say thank you to the Right Honourable Speaker for responding with logistics worth over 300,000 Ghana cedis in terms of drugs and other logistics to the Upper West in response to the meningitis outbreak there. Likewise, national lotteries the NDC Upper West MP's caucus, we also responded with support of 10,000 Ghanaians. And all those who have supported, I want to say that we are grateful. Yes, especially the Right Honorable Speaker. We are very, very grateful. In conclusion, Mr. Speaker, I want to add my voice to the Minister by saying that there's a need for community engagement, public education, because with all these diseases, when the patients report early, the chances of survival is good, because treatments are available. But when they report late, then not much can be done to save these lives. So I encourage all patients, anybody with signs and symptoms of these diseases, whether cholera, meningitis, to report early to the nearest health facility, for medication. I thank you, Mr. Speaker, for giving me the opportunity. Thanks to the Minister for Health, his technical team, and thanks to the Right Honorable Speaker, for coming to the aid of our people. Thank you very much.
Thank you very much, Honorable Dr. Sandari. Yes, Honorable Member, you have the floor.
Thank you very much, Mr. Speaker, for the opportunity given me. Mr. Speaker, whilst commenting on the Honorable Minister of Health statement, I want to particularly commend you for being a pillar of encouragement for fresh women and men in this House. God bless you for that, Mr. Speaker. Mr. Speaker, in proceeding, the statistics show that, Mr. Speaker, there is a link between our economic status and the disease called cholera. Mr. Speaker, the statistics by the World Health Organization shows that out of the about 1.3 million to 4 million people that suffer from cholera annually, about 1.3 million of them come from Africa. Mr. Speaker, out of the between 21,000 to 143,000 people that die out of cholera annually, about 57% of them come from Africa. And so, Mr. Speaker, there is a link between development status, very respectfully, and the disease. Mr. Speaker, the learning is that education, very respectfully, reduces or increases wealth. And indeed, when we say health is wealth, then of course, the level of education should have a bearing on disease control and protection. In that regard, Mr. Speaker, I would want to pray that the Honorable Minister for Health make it his objective that during his tenure, we are going to have a robust fight against malaria, cholera, and meningitis, so that, Mr. Speaker, we free ourselves from the consequence that, Mr. Speaker, that comes with it annually. Thank you very much.
Thank you. I proceed to give the floor to Honorable Haji Aladi Ayamba.
Thank you, Mr. Speaker, for the opportunity to contribute to the statement ably made by the Minister for Health. And I really appreciate his effort in coming fast to respond to the demand for a statement and what clarity there is. Mr. Speaker, somewhere last week, we discussed extensively the issue of cholera especially. Today, we have gotten a lot of in-depth information on cholera and how the Ministry of Health and its associates intend to handle. Mr. Speaker, I believe that most of us, especially within the communities, and for that matter, the health sector, the community health nurses, should be involved in education about cholera. It is quite a difficult situation. Sometimes you might think that is an issue of just talking and then leaving, but it needs follow-ups. Mr. Speaker, in the villages, we shouldn't forget that there is still open defecation. And with open defecation, it goes with a lot. Flies, all types of flies. We have the green fly, we have the cheche flies, we have all of them, they just go, they run back into the houses and sit on food. When they fly back to houses and then sit on food, it is eaten without maybe even heating it. Children go to ease themselves, they come back, they eat without washing their hands, a whole lot. So we are quite aware of that. But I will also suggest to the Minister for Health, see, these community health nurses who are supposed to get to hinterlands, I made this point last week and I'll continue to make it. Transportation is a very big problem for them. Transportation is a very big problem. How long can one walk? And how many houses or communities can one visit in a week? If at all they can get the people to talk to them. So I would first of all talk about the issue of transportation for our health workers, especially the community health nurses. Secondly, we should be able to get those that in those days we used to call them sama-sama. And they are the people who would go around as early as possible to see to it that all houses are cleaned properly. Even where you put your water, they will come in and check it to make sure that the pot is clean and that you have good drinking water. We've thrown off all these people and we believe that what we are doing today is the best. Or we have grown, we have gone digital, so we don't care. We can get pipe-borne water. We need these people to help us. But I appreciate the fact that I tried to find out from the minister about free health care for those who have cholera, or where there is cholera outbreak, communities where there is cholera outbreak, and he has made it clear to me that places that are affected can have free treatment. This should go a long way. Let us get to the community radios, the radio stations, the various healthcare centers, the services, to let them understand, because most people, as we sit here, we talk, but there are people who might have not heard a word from the radio or from any other person educating that person for more than a year now. So they don't even know that it's for free. They wouldn't know, they think, I don't have money. There's little I can do. I will not be able to go to the hospital. So they remain there until when the inevitable happens, death comes. And it is that cholera is killing us because there is a lot of ignorance. So I will say, let us get communities to give the education. Meningitis is what he mentioned, and it is going to become more serious because when it gets to March, April, the sun becomes so hot, especially in the 5 regions of the north, to the extent that many are not able to sleep in their rooms. And when that happens, and they are compelled to sleep in the room because of what? Mosquitoes. While it is hot, there are also mosquitoes. So they are compelled to go into the room. And most of the rooms in our villages do not have even windows. Even if there are windows, they will not be opened because mosquitoes will surely what? Go in. So I am suggesting that the mosquito nets that used to be given, we ensure that every household gets enough, because prevention is better than cure. We shouldn't go to a house and give it to 3 or 4 people and say, oh, we serve this house. And let us also give the education and make them understand that it is dangerous for them to sleep in large numbers inside their rooms. When we are able to do this, it will go a long way to help. The minister also made me to understand when I was asking him that with meningitis, it is free treatment. Again, we need the education. We need the message to go. We need our people to understand. We should put ourselves in it. And I think with this one, Mr. Speaker, it will help us a lot. I will appreciate and wish to tell or suggest to my colleagues here that we shouldn't leave this to be a 9-day wonder as we have discussed here, but we should take it out there and ensure that we help in the education so that at least our people will be better informed. I thank you very much, Mr. Speaker. Congratulations and bye-bye.
Order. Honorable former Minister.
Speaker, for calling me to add my voice to the statement made by the Minister for Health. Mr. Speaker, I'm very happy this issue has come back full circle to this House. Mr. Speaker, I believe that first and foremost, prevention is always better than cure. And I believe that for cholera, that is not something that is happening to Ghana the first time maybe in the last 50 years. They seem to reoccur and reoccur and reoccur. Unfortunately, when they occur, public officers bear the brunt, as if they are the people causing the problem. But from all the speakers and from literature and practice, you realize that sanitation is number one. Mr. Speaker, how can we have a country where people build houses and there are no toilets in them? How can we? How can we have people use the washrooms, don't wash their hands, and go and eat? How can we get food vendors prepare food without cooking them well or washing them well, and still blame somebody outside the vicinity? So I believe that it is time we educate our people that prevention is always better than cure. And if you actually understand what happened during the COVID period, where we didn't record any cholera cases, it was because we were practicing safe hygiene, using sanitizers, washing our hands, and all that. And I believe that we have to bring that focus back on that safety, hygienic practices again, so that Ghanaians understand that cholera can be prevented. When I was a child, what I realized was that anytime mangoes started booming in town, cholera also reared its ugly head. So ever since I was a child, anytime there was mango in town, I never eat mango. I wait for the mango to prevent cholera. And it has worked for me up till today. So I believe that this business of toilets not being in homes is something that the local government minister would have to take it on seriously. At least there should be one toilet, one family. If it's even a compound house and we have 3 different families, they should have 3 different toilets. Because we all know that public toilets are not safe. We all know. We know emergency cases in schools or maybe in lorry parks, but in communities, we should do whatever it takes to make sure that we put toilets in every home. That should be the strategy. Otherwise, we'll come back to be talking about these things all the time. Doctor also made mention of the town council people that used to come around when we were children. They call them tankers. In fact, in those days when we were kids and you hear that the tankers were coming to your area, every household got cleaned up because you know that you are going to be charged. Recently in my region, we introduced what we call the e-tankers, where we try to digitalize the tankers program. And virtually all the district assemblies, town council, we call them tankers. Town councils, yes, that's correct. We got the environmental officers to use technology to monitor homes and the rest. And we could see the trend that people were trying to come up speed. Along the line, they started using it even as propaganda. That is the regional minister that have sent people to come and check their homes. But the fact of the matter is that cleanliness is next to godliness. And I believe that if we're able to do more of these, it will help us do better. Mr. Speaker, whilst the minister was speaking, he was very bold to thank the nurses. And I'm very happy. But we've seen a circular also sacking nurses. So I'm wondering, is he using the letter to thank them? Or is really thanking them because they've done a yeoman's job? Because how can you sack people you are thanking for getting employment to help the health sector improve and sustain itself? So, Mr. Speaker, I believe that this issue is as simple as ABC. We should continue to preach prevention, show people what they should do when they get it, and then attend to the health facilities. Because, Mr. Speaker, it is a fact that those who don't report within the first 24 hours of visible symptoms of cholera, especially those who are dehydrating, die. So it is always good that they go there as quickly as possible. We know ORS and the rest can be used, but if you are not careful and you don't apply it properly, you lose a lot of water and you dehydrate to the extent that sometimes we call cholera the blue death. So I believe that reporting as quickly as possible to the health facility is very important. And because most people also don't show the symptoms, Mr. Speaker, it is also very dangerous. That is why prevention is also key to this progress of this disease. On meningitis, like we all know, is basically a disease of inflammation of the brain, tissues around the brain. And it's caused by a lot of different agents. There's medicine for a lot of them, and people should report as quickly to the health facilities for checkups and for treatment so that we can save more lives and save this country. With this few words, Mr. Speaker, thank you very much for giving me the opportunity to add my voice.
Thank you very much. It's now the turn of Honorable Dr. Anaba.
Thank you very much, Mr. Speaker, for the opportunity. Let me thank the Minister for responding so quickly to the statement made by Honorable Member Sanja last week, and the very elaborate response he has brought to Parliament that is consistent with what is expected of him as a minister and his ministry. He has elaborated how the ministry has set up so many steps from multi-sectorial approach coordination, including environmental assessment of areas that are affected, contact tracing to ensure that those who are affected do not disseminate the disease, especially the cholera cases, vaccination and training of staff. These are all commendable. In fact, I think that we would continue to treat cholera in this country for years and will never end unless the right things are done. I think that if I recollect, in October 9th, 2016, one gentleman in this country made a statement that I think that we have to go back and embrace it to end cholera in this country and some infectious diseases. The person said, no village will have water and toilet problems in our first 2 years when we are in government. I pick it back because I think that is the long-term solution that would end cholera in Ghana. If you check the whole world, Mr. Speaker, cholera is in Africa, Caribbean, and Asia. It means that there is something wrong. The serious outbreak of cholera in UK is about 300 years ago. They've not experienced it again. is because sanitation is given priority. We've seen so much spent in sanitation in this country, yet we have typhoid, we have cholera, killing people every year, now and then. Let's continue to educate our people and treat the current acute cases. But I would call on the multi-sectorial approach the minister is talking of, that it should involve medium and long-term measures. Mr. Speaker, just like some of the contributors have said, ensure that no one should build a house without a toilet, and there should not be a public space without a toilet. No one should sell food that he has properly cooked in his house, but ironically come and sell it on top of a gutter. It shows that the fumes coming from the gutter, with the typhoid, with the cholera or whatever, we are going to eat it, even though the food was properly cooked. So district assemblies should play a role in regulating this. So that of the cholera, I think we would never get it stopped if we don't take measures to implement what somebody prophesied in October 2016. Coming to the meningitis, I know they've done a good job, the Ghana Health Service, the minister, by providing free care education to the communities, and that is ongoing. People are reporting. But one thing that is striking is that the meningitis belts, when I checked current reports, none of the countries in the meningitis belt is suffering from meningitis for the past 2 years. From Senegal to Ethiopia. And in Ghana, the pathogen that is normally causing the meningitis is not the one this time. It is a different one, which does not respond to the vaccine that is used for this particular, for the one that we know. It shows there is something, and that is why we need epidemiologists together with Ghana Health Service, the Ministry of Health, to investigate. Could it be that we are abusing antibiotics? That is why this particular strain is so virulent and causing more meningitis. Let's research into it. Because if Burkina, which has the harshest conditions of the Harmattan, this year is not experiencing meningitis, Senegal is not experiencing, Mali is not experiencing, Ethiopia is not experiencing, why should it be Ghana? And even Ghana, Upper East is not experiencing. There is something we need to investigate. And I leave that one to the minister and his team to go and look at it. Let's make sure our epidemiologists, our laboratories research into it and see whether we identify the reason why we have repeated meningitis in Ghana every year, while the meningitis belt, countries in the meningitis belt are free from it. Burkina Faso has used the vaccine that is good for the pneumococcal to work very well for them, and they have not experienced meningitis for the past 3 years. So let's research into it. I'll end here by thanking the minister for the good job, and also thank the Speaker of Parliament for his sumptuous contribution to help the people in the Upper West for the meningitis outbreak that has taken about 18 lives over there. So thank you very much, Mr. Speaker, for the opportunity.
Thank you, Honorable Dr. Anaba. Leadership.
Mr. Speaker, thank you for the opportunity, and let me thank the Minister for responding to the call by this House to make a statement on this important matter affecting our people. Mr. Speaker, the Minister took us through some interventions that his ministry has made so far. But I just want to point out some few things for his further consideration. In a statement, he said that the infection rate in the central region has a footstool topping, which is true. However, in terms of vaccination, his submission points to the fact that they are yet to get approval for Efutu, I felt that should rather be prioritized. Because if Agona West is recording just 6 and you have 18 in Efutu and you are rather vaccinating in Agona West, you may have to look at it instead of saying that you are now seeking approval for Efutu. Then, Mr. Speaker, he again talks about the sudden rise since January of the situation in Winneba. Mr. Speaker, it is so because, you know, sometimes when there is change in power, the way our locals react, all public toilets in Efutu at the Inshona have been seized and locked. And you, the minister, fortunately you went to Winneba and you met the fisher folks at the Inshona. And that's where the problem is. So they have no place to ease themselves. And it's a problem. You know, given the history of this situation, and we know how people contract it. If a party comes into government and somebody thinks that, let me go and lock up a toilet. When there is cholera outbreak, it doesn't know party colors, whether you are CPP, MPP, or NDC. So I believe that that is a matter that has to be looked at critically. And I'm sure that upon that, we would be able to deal with the situation and contain it. Mr. Speaker, the minister called on local government authorities to support the ministry. It is true that to enable you function and function well, you need the support of the local government institutions led by political leaders. Mr. Speaker, fortunately, I've seen Honorable Ahmed Ibrahim, the Minister of Local Government and Chieftaincy. We know that when Professor Mills of blessed memory assumed the reins of government, his policy was for those who were appointed by the Kufuor administration to continue until a smooth transition took place. That, Mr. Speaker, helped in a seamless governance at the local level, where some new appointments were made and there was a formal handing over. Unfortunately, this time around, the posture or the policy was different. Almost on the second day into the administration, all appointments were revoked. As we speak, there is no leadership at the local government.
Honorable Minority Leader, we are taking comment on the briefing of the Honorable Minister responsible for health on meningitis and cholera.
Mr. Speaker, the minister invited us to assist at the local level, and he talked about governance at the local level. I need to lay a foundation in respect of the comment. Mr. Speaker, the point is that there is no political leadership at the local government level. I am calling on the Minister of Local Government and Chieftaincy Affairs to expedite the process. Because, Mr. Speaker, all the policies of government, Ministry of Education, Ministry of Health, the implementation agents, the implementation authority is given to the MMDC. Everything would end there. Without the MMDC, government policy cannot be implemented at the local level. As it is today, we only have the coordinating directors acting. They are unable to even call assembly meetings. So, Mr. Speaker, as part of the call, as part of the call by the Minister of Health, I believe that to enable him roll out these interventions effectively, the Minister of Local Government may also have to support by expediting action on the appointment of MMDCs so that together they can roll this out. Our people are suffering, Mr. Speaker. Our people are suffering. And without political leadership, it will be difficult. Second and final, he also called on support from the healthcare professionals. He, in fact, commended their industry thus far. But, Mr. Speaker, the only way we can have adequate support for intervention would be to have sufficient staff levels. Mr. Speaker, as we speak, the minister is aware that appointment of healthcare professionals are being revoked. He is calling for intervention. He is calling for more healthcare professionals to support. Mr. Speaker, I heard Honorable Ladi talked about the community health nurses. They are the people who undertake the education at the local level. Many of our people, yes, we speak here, but many of our people do not get the information. The basics are always handled by the community health nurses. This is a situation where community health nurses who have been employed have been given termination letters, and this is the very time that the Minister of Health need their support.
Honorable Minority Leader, I recognize the Majority Leader. Majority Leader, are you on point of order?
Mr. Speaker,
Majority Chief Whip.
The
Majority Chief Whip.
Thank you very much. Mr. Speaker, I rise pursuant to Order 1221A. Mr. Speaker, my point is that, one, there was no indication in the minister's statement that minus the MMDCs, his ministry is not making interventions. So it is mostly inaccurate for the minority leader to suggest that the absence of MMDCs is hampering and affecting remediable measures being deployed by the ministry in dealing with the problem at hand. That's one. Two, Mr. Speaker, the minority leader is on record for stating emphatically that the president need not appoint or nominate an MC for his constituency or district. He is on record to have said he has not rebutted that reportage. So today, I am surprised that he's crying for an MMDC to be appointed for a Futu. Mr. Speaker, number three, there is no relevance or connection between the directive to terminate employments done by public agencies ex post facto December 7th and the remediable measures deployed by the Ministry of Health to deal with this matter. Mr. Speaker, the minister has not recounted the inadequacy of staff in dealing with the problem. So it is mischievous for the minority leader to suggest that we are in the process of terminating appointments of health personnel who have been deployed onto the field to deal with the problem. Mr. Speaker, I want to urge the minority leader to avert his mind to the fact that rendering of health services is so decentralized to the very communities. So he should make his point, he should make submissions and praise the minister for the alacrity with which he has moved to deal with the problem, and not to be political. I thank you for the opportunity.
Honorable members, I indicated right from the beginning before giving the floor that we should be guided by Standing Order 91, 3 and 4. Honorable members, let me read. A member may comment on the statement, and the comment shall not provoke debate. 4. A member commenting on the statement shall not take more than 5 minutes, except otherwise permitted by the Speaker. So, Honorable Minority Leader, proceed and conclude, limiting it to the briefing of the Minister responsible
Speaker,
for health.
Mr. Speaker, let me make an observation first, then comply with your order. Mr. Speaker, this is the umpteenth time I have made this observation, that if we are setting a certain precedent, which is anew, I will take notes, but I know that there is always a tomorrow in this house. Mr. Speaker, my respected colleague, who I listened to in silence, made an intervention, a supposed point of order, spoke for 7 minutes. I quietly checked the time. Mr. Speaker, if there might be silence, I listen. Mr. Speaker, we are in this chamber. Members have made their contributions. I took note. I would want Honorable Akando's statement to be made available again to him. I took note. MMDCs, Honorable Akando made a call on us that the local government authority would have to be up and doing, and he needs the authorities to be in place. Mr. Speaker, all I am saying, Mr. Speaker, all I'm saying is that we need to have...
Honourable members, let there be order.
Mr. Speaker, the impatience and the intolerance must be dealt with so that we can have a very decent debate. Mr. Speaker, the point I am making is that we need to have the political heads to be in office to assist in the implementation of government policy. And I'm happy that the minister responsible for local government and chieftaincy affairs is in the chamber so that he takes it up in expediting it. Mr. Speaker, the minority chief whip in his intervention also made a point that I am on record to have said.
He's not the minority chief whip, he's the majority chief
well,
whip.
Mr. Speaker, I slipped. You yourself called him the majority leader. You also slipped earlier. So no problem. He is the majority chief whip and not the majority leader. Neither is he the minority chief whip. Mr. Speaker, I would have called the chair with respect. Let's treat each other that way. Mr. Speaker, he said, I am on record to have said, I don't need an MC in Winneba. Mr. Speaker, it is not true. He should quote me and quote me right. This is Hansard. So when he wants to quote me, he should quote me right. Mr. Speaker, on the issue of healthcare professionals, the call by the Minister of Health was for support to healthcare professionals. And when the Honorable Ladi contributed, her contention was that we need to have more of these community health nurses because they are the people who do the direct interface to educate our people. That was a call by Honorable Ladi. And I'm adding my voice to that call by urging upon the minister to ensure that more healthcare professionals are employed. Mr. Speaker, the Honorable Minister is aware that termination letters have been issued out to healthcare professionals who have just been employed. And I'm making a call on him that considering the fact that we need more nurses to address this matter, he should relook at the situation. Mr. Speaker, here's a situation where a member of parliament for Pusiga is calling on us to engage more community health nurses at the local level to educate our people. He expressed frustration on this meningitis thing in the north, and I also know that when it comes to preventive healthcare, we need more healthcare professionals. Mr. Speaker, in a situation where the minister needs such support to roll out government policy, it is only right and far right to call on the Honorable Minister to ensure that no healthcare professional loses a job, and that the backlog of healthcare professionals who have graduated and are at home, government ensures expedited steps in employing them. We know the budget is coming. It is a call on the Minister of Health to engage the Finance Minister to make adequate provision so that there will be clearance for more nurses and other healthcare professionals to be employed. By this, the situation will be handy because those who have been trained will be there in the communities to support our people. Our people are suffering, and he knows so. Mr. Speaker, social intervention. I support the call by Honorable Ladi, Member of Parliament for Pusiga, that there should be more social intervention like the mosquito net is talked about. Mr. Speaker, if we don't get social intervention evenly distributed and fairly given to the most vulnerable groups, Mr. Speaker, how would we be dealing with the situation as the Minister has briefed us on? We need to have a transparent system where the vulnerable in our communities will get the support. And this, I believe, if Minister is able to do, there will be relief at the local level. Let me, in conclusion, thank the Honorable Minister, who is a very respected colleague, for acknowledging my contribution in the fight against this menace, unfortunately. Suffice to state that he made a general acknowledgement. But just for the record and for Hansen, I have released a brand new pickup, which he knows, and I've also given a cash donation of 100,000 Ghana cedis, which he acknowledges. But Mr. Speaker, and also to thank him for making it to Winneba over the weekend. It was a promise he made that he would be in Winneba. He was in Winneba. And much as we hear to critique government, when the man does it well too, it is important that he is showing leadership. At least when he was there, those healthcare professionals were inspired, particularly the director of the Municipal Health Directorate, Dr. Paulette Brown. And I want to take this opportunity to commend all of them. Mr. Speaker, they have not slept on this matter. They've been disturbing me with it, getting me to reach out to the minister, and they've been very collective. So far, all the health facilities have been made available. And Mr. Speaker, it is important that I point out that of the 21 health centers in Ifutu, 17 were constructed by me with my own pocket money. And all these facilities, yes, Mr. Speaker, the Papa Kodamti Health Center, the Akosua Village, the Penche, the Nye Frame Health Facility, the Jahazi Health Facility, the Dr. Pra Health Facility, the George Kwame Kwanzaa Health Facility, and the Samuel Owusu J Health Facility. Mr. Speaker, these are health facilities are constructed and finished, and these facilities are providing support to our people. And Mr. Speaker, we will continue to serve the people and continue to rely on the Honorable Minister for his support, because there's a new children's hospital coming up. There's a new children's hospital coming up at Jenjazi. It's a 150-bed children's hospital, and it will be an intervention for both primary and secondary support facility. And I'm sure with that cooperation, in future, we will be able to address some of these things adequately. And Mr. Speaker, I would want to assure the Honorable Minister that just as we've been doing in the past, there will be cooperation. There will be cooperation to enable our people benefit. But you should remember that in terms of support to the health sector, Efutu must get its fair share. Mr. Speaker, without more, I would like to thank you for this treasure space. God bless you.
Thank you, honorable members. Because you've brought the minister responsible for local government into the debate, I intend giving him the floor.
Thank you, Honorable Speaker, for giving me the opportunity. Honorable Speaker, to begin with, I must take this opportunity to commend the maker of the statement, Honorable Kobina Minta Akano. In fact, having metamorphosed from ranking member on health to the minister responsible for health, he has started on a very good note. And I think everybody admires that. But Mr. Speaker, it is on record, and as the maker of the statement has stated, that the cholera outbreak was inherited from the previous administration. And Mr. Speaker, may I read for you bulletin. Mr. Speaker, I must put on record that the current outbreak began over 5 months ago in October 2024 in Adan West in the Greater Accra region. Mr. Speaker, how do you blame the absence of MMDC from post on this? If there is cholera outbreak, it's a health problem, and you are attributing political problem for health problem. How can that be? Health issues, and you are using political solution. Oh, leave that. But Mr. Speaker, to proceed. Yes, it is true that Professor Mills, when he took the baton from the former President Kufuor, he allowed the MMDCs to be at post for over 5 months. That was a good example. But that opportunity too was eroded by his successor. Yes. When Nana Addo Dankwa took the baton from President Mahama on 13th January, he issued a directive and all MMDCs were to vacate posts. When they came from the swearing in, by the time they returned to their districts, their positions were vacated. Mr. Speaker, to proceed, even Nana Addo Dankwa himself, succeeding himself, all those MMDC who were perceived to be Alan, 134 of them were sacked. You are aware of this? The same administration, 134 MMDCs were sacked. So how do you blame us with this? But Mr. Speaker, I wanted to raise point of order to clear this. And you say you give me the opportunity to state. That's why I'm stating them. That is not the solution. Mr. Speaker, to continue, you blaming us. You are on record to have said that you ensure that no DCE is approved in your constituency.
Honourable member, conclude.
You are on record to have said that. So what are you saying? Mr. Speaker, you are record as majority leader to have said that you will not allow a DCE to be approved in the future. And if you don't approve this, how will you get DCE? Meanwhile, there's cholera outbreak, and you know DCE will come and solve it. And you are saying you will not allow us to have DCE there. So you don't have you don't want the problem to be solved. Mr. Speaker, to proceed.
Honourable member, conclude.
Mr. Speaker, I was mentioned.
Honourable Minister responsible for local government, chieftaincy, and religious affairs. Conclude.
So, Mr. Speaker, why? This is a response to a majority leader's call.
Honourable Minister responsible for local government, chieftaincy, and religious affairs.
Yes.
Yes, Honourable Minority Leader.
Mr. Speaker.
I've given the floor to Honourable Minority Leader.
Mr. Speaker, my colleagues are creating the impression that it is one Afenyo marker against 1,000 NDC. No problem. Yes. One Afenyo marking, when Afenyo marking speaks, 1,000 NDCs are on their feet. Mr. Speaker, with the greatest respect, this is not a time for us to debate. But I believe that the Honourable Minister for Local Government has misconstrued my comments and misappreciated same. And I would respond to him with 2 points. One, the maker of the statement himself made a call on us. And Mr. Speaker, my style is always to take notes. So I took notes on all the points he raised. So I have here the need to have MMDCs in place. It was his call. Check his statement again. I am not making a political statement. He himself made a call. So I said that to the extent that you are in the chamber, take this on board. Take this on board so that you facilitate the appointment of MMDCs. Second, the issue of Akufo-Addo and all. Mr. Speaker, Nana Addo Dankwa Akufo-Addo does not come in this matter. Nana Addo Dankwa Akufo-Addo does not come in this matter. It is your government in office. And all we are saying is that there is a cholera outbreak, and the minister wants the local government authority to be properly constituted to take this matter up. What you are supposed to do as a local government minister is to expedite action. It's not to take issue with me. It's not to take issue with me. It's to urge on government to speed up the nomination.
Honourable members, order. Honourable, I'm watching your disorderly conduct.
We need the nominations to be done as quickly as possible, and when the nomination is done, we would be able to go through the confirmation process. As to what is happening in Winneba, Mr. Speaker, if you want to bring constituency matters to this floor, I don't think that it will be appropriate to be bringing partisan rally comments on this floor. Mr. Speaker, Ahmed knows that we have one republic. That is the Republic of Ghana.
Honourable Minority Leader.
Mr. Speaker, I need to finish with respect. Honourable Defia Makwa was allowed to finish. Mr. Speaker, let me finish. He called him on a point of order against me, and I quietly listened to him. So let me conclude respectfully. I need to conclude respectfully.
Then conclude.
I will, Mr. Speaker. I will. What happens in Winneba at rally, where we say, "Oh, Republic of Efutu," those are, Mr. Speaker, those are matters for political excitement. Yes. Mr. Speaker, if I go and meet if I go and meet my local foot soldiers and I say the Republic of Efutu, when we all know by law there's one republic? Is this a matter that the presiding elder of the Pentecost Church, who has now been elevated to the status of minister of local government, and you know that I was part of the approval process. I was part of your approval process. Is it a matter for you to come and raise here? Mr. Speaker, what is a notorious fact is that in Efutu, all the assembly members are MPP members. Time is up. So we want you to plead with us. Yes. Then when you bring a good nominee, a good candidate, we are going to support you. But if you don't bring a good candidate, it will be difficult. But this is not about winning, but it's about the nation. It's a matter for the nation.
Honorable Minority Leader, please conclude.
Mr. Speaker, they have to tolerate on this matter. Yes, I said so. That is true. Mr. Speaker, that is true.
Members,
all the assembly members are MPP members.
If you don't have the floor, resume your seat. Honorable members, sometimes out of respect to the leadership of the House, we normally don't rule them out of order. But if that is what the leadership is expecting from the chair, I will not hesitate to do so. I had the cause to admonish the Honorable Speaker, the Honorable Minister responsible for health is on cholera and meningitis, indicative of the fact that we are moving into matters not relevant to the issue at stake. What other indication can I give to a leader apart from what I have said? But when it happened, and that cue is not being taken from the guide being given by the chair, then we have to go strictly and apply the rules. In that case, the leadership must take it in good faith. Ordinarily, I was not going to recognize the minister responsible for local government, chieftaincy, and religious affairs, but his name has been mentioned multiple times. That is why I have decided to hear him. So, Honorable Minister, please conclude.
Thank you, Mr. Speaker. Mr. Speaker, in conclusion, I want to use this opportunity to also remind this very House that the disease we are all talking about has no political colors, and therefore it behoves on all of us to make sure that we take appropriate steps to help cure the disease. But, Mr. Speaker, it's only good to hear from the minister that the situation is improving, which means the minister and his ministry are on course. However, Mr. Speaker, there needs to be an interministerial and intersectoral approach, because in terms of sanitation, part of sanitation falls under the minister responsible for youth and minister responsible for youth, and part also falls on the minister responsible for local government. However, on the area of water, that also falls under the minister responsible for works and housing. So the four of us need to come together: the minister for health, the minister for local government, chieftaincy and religious affairs, the minister for works and housing, and the minister for environment, and the minister for youth. The five of us have a role to play. Mr. Speaker, if we play this well, we can help improve our hygiene, help improve our water, help improve our environment, and we may be able to end improving the cholera outbreak that we are talking of. So, Mr. Speaker, I must thank the maker of the statement and also fall upon this House. The President has promised about National Sanitation Day. The budget is yet to come. We must budget for it before we can implement it. The common fund, this Assembly Common Fund formula, we brought before you. Mr. Speaker, when that comes, we must make provision for sanitation. Make sure that our sanitation workers are paid. In the budget too, the sanitary inspector that you are all calling for has also been promised in our manifesto. It will be translated in the budget. So when the time for approval comes, we must take all the submissions that have been made on this floor into contribution, into approving the budget. By so doing, Mr. Speaker, we may be able to help together to build Mother Ghana. Thank you for the opportunity.
Thank you very much, Majority Leadership. Majority Leadership.
Thank you, Mr. Speaker, for the opportunity to add my voice to the statement.
Speaker, with your leave, the Honorable Minister for Rules wants to provide very quick information. Oh, why? What is wrong? I have been recognized by
Honorable Majority Whip. Honorable Majority Whip.
The leave of the Speaker. It is up to
Honorable
Speaker
Majority
to grant
Whip.
it or not to grant it.
Honorable Majority Whip.
Yes, Mr. Speaker.
If the leadership, the majority leadership wants to cede to the Minister for Roads and Transport, I would allow that.
Mr. Speaker, that is not my request. With all due respect, if you may hear me, he says he has an information to give to the House.
So,
please, Mr. Speaker,
Honorable Majority,
please sit down.
Honorable Majority Whip.
Please.
Honorable Majority Whip.
Why? What is wrong with you?
Honorable Majority Whip. Majority Whip. Will you listen for a minute?
I'm listening.
Yes. I know exactly what I am doing.
Very well.
I am engaging the minister in a negotiation.
Very well.
So I'm making a sign between him and myself.
Very well.
So therefore I know exactly what I am doing.
Very well, Mr.
So
Speaker.
Honorable Comfordoyo, you have the floor.
So I yield.
Do sit down. Sit down. Please sit down. Sit down.
Mr. Speaker, with all due respect, I give due regard to my brother on the other side. With all due respect, he should return the courtesy. With all due respect, Mr. Speaker, I thank you for the opportunity.
Honorable
Thank you, Mr. Speaker,
you have the floor.
for the opportunity to add my voice to the statement made by the Health Minister. Mr. Speaker, it's about time that we need to speak the truth to ourselves. Mr. Speaker, the whole statement is about cholera, and cholera this year is started from Adam. And when you want to understand what cholera means, which means somebody has eaten feces. Mr. Speaker, what brings about all those things is about sanitation. Whether we do proper sanitation. Mr. Speaker, just 2 months ago, there is a whole ministry for sanitation. And if you look at the budget for that ministry, and if you look at that budget and the sanitation doesn't go down to the people, then, Mr. Speaker, I beg to differ. We are not speaking truth to ourselves. Companies are paid for sanitation, but when you go to our villages, our other places, you can see that the containers are there and they are full, and nobody is taking care of it. Mr. Speaker, that money that we spend, especially the budget that we spend on sanitation, why don't we give it to the chiefs? And the chiefs will take care of the village and the environment. Because when you assign a chief to take care of his environment and you pay him for that, and he has the people that will do it, they will make sure that there is the whole place will be neat. Just Just this Sunday, I visited a village called Kwalakpoyom in my constituency. They have swept everywhere, every corner of the village is clean and neat. And if we can encourage them, Mr. Speaker, I think they will do proper work than what that telling our mothers and fathers that we have been educated and we will take care of them, we couldn't do, they will do it for themselves. Mr. Speaker, let's be honest. Eating feces is what brings cholera. Where do we get them to eat? From the insects, and then flies, then vendors. Then the latest one, Mr. Speaker, which we are not watching, the bedroom. Now people are eating feces there, in the bedrooms. So we should check all those areas. Because if we are not careful, we will be pointed out to the vendors. Meanwhile, they are innocent when it comes to those things. Mr. Speaker, let's revisit how we are managing sanitation. We have chiefs in every area. Even if we deter them alone, and governments issue instructions that every chief should make sure his environment is clean, we will get a solution to this problem. So we shouldn't deceive ourselves and be beating around the bush as if we are working, but we are not working. Mr. Speaker, we need to sit down and do proper planning and work around these issues well, so that we will get the right results. Village by village, every electoral area, there is assemblyman. Work with your chief, at least a small budget for the chief. Instead of leaving the budget in the ministry, that budget should go there, and let's see whether we will not get results. They have a way of burning their refuse, and they can even use it for manure in their farms. So, Mr. Speaker, the way we started it and it's not working, let's change the style now and use our traditional council, our chiefs, assembly members, and then unit committee. We have unit committee members, we are not using them because of we are not giving them small allowance to go about and work in their villages. Mr. Speaker, let's use the unit committee, the assembly members, the chiefs, so that those budgets should go to them. And let's see whether we will not get the proper results. Thank you, Mr. Speaker, for the opportunity.
Thank you. Before giving the floor to the Honorable Minister to wind up, I recognize Honorable Kwame Agboja on point of information.
Mr. Speaker, I thank you for the opportunity. I am not making a contribution to the statement, though I must commend the Minister and the colleagues who contributed. Mr. Speaker, in this House, we have different people with different backgrounds. In this chamber, myself and Honorable Gisela Agochi Tete are the only architects in this House. If a colleague gets up and makes a statement, of course, if I make a statement which is borders on law and is completely inappropriate, you expect that the lawyers here ought to correct me. There's something that the respected minority leader said, that he's building a 150-bed children's hospital. Mr. Speaker, a lot of people make this mistake. It's not his fault. And this is the reason. Mr. Speaker, in our country, by the health planning standards, district hospitals are facilities with beds 60 to 120. When it gets to 120 to 400, it's a regional hospital. The fact that you can fit 100 beds into this chamber doesn't make it a district hospital. So it is important that when we are making interventions, and indeed, Mr. Speaker, the interventions of the minority leader in terms of provision of healthcare facilities is known, and colleagues have done that. But, for instance, to build a district hospital, even for 60 beds, you are getting close to almost $19 million. And it comes with 20 different departments. So when you are speaking in Parliament to make this statement and we let it go, somebody will hear that MPs are capable of building district hospitals. Why is the other MP not be able to build it? So it's important we make this. So my point is that if it will be good if the health minister, who is one of us, can one day take the opportunity to come and read out to us what are the standards of a cheap compound, a health facility, a polyclinic, a district hospital and a regional hospital, it will guide us. So when we are making the interventions, we just don't say that I build a space that can take 100 beds, so I build a district hospital. Because it's not as simple as that. That is not the information I wanted to provide.
Thank you. Thank you very much. Honorable Minority Leader.
Yeah, Mr. Speaker. Mr. Speaker. I thank you for the opportunity. Mr. Speaker, let me thank Honorable Kwame Abuja for his intervention and putting the matter in the professional perspective. I don't just speak. That children's hospital, I wish you get the opportunity to visit. It was properly designed by a professional architect. Professionals are involved in the construction. It has all the departments to make it a secondary referral facility. You need to see with your eyes. Don't worry. You need to, Honorable Abuja, who also doubles as an architect, I would want to have an hour ride with you to Winneba. Winneba is just 45 minutes drive from Accra. No, at least we'll get a dispatch. He has a dispatch rider. So we can take 45 minutes. Don't worry, Yusuf don't have a dispatch rider. It's okay. I have one. We'll go with mine. Mr. Speaker, 45 minutes, you can go and see for yourself what is happening at Jane Jazi in Winneba. Mr. Speaker, I am not making a submission on the House floor out of ignorance. The professionals have indeed determined the capacity of the facility. It is not just a primary facility, it is a secondary facility. So, Mr. Speaker, I know what I am saying, that it is a 150-bed children's hospital, and it is coming from the professionals. So, Mr. Speaker, I think that clarification has to be emphasized so that he knows that indeed it is not just a district facility that I'm referring to. If it were to be a healthcare center, I would say that it's a healthcare center or a CHIPS. It is not. And it is not.
Honorable Majority Leader, a minority leader, he's raising a second part of the problem, which poses danger to all of us. Probably you have the means. Maybe you are a deputy leader, you became a leader. Therefore, what you can do, even most of the people at your back may not be able to do it. When the public begin to measure us.
Mr. Speaker, I keep saying that the precedents we are setting, let's be guided. He got up on a point of information. He said, and you granted him that special leave. As to an intervention by a member in his constituency, it is his bona fide. We know that as a fact. So it depends on your constituency and the things that you would want to do and the personal effort. We all know we come here as lawmakers, but our people don't see us as lawmakers. They see us as agents for development. So I do not think that it is right for him to now bring up the second matter. The issue he raised was that he's an architect. And as an architect, there is a certain essential qualification to designate a facility as a 150-bed facility or 60-bed facility. So he wanted to put that on.
Honorable Minority Leader, yes. Are we really agents for development?
I said our people see us as such. And practically that's the work we do. We pay school fees. We are required to build hospitals. we are required to aid
So
in the
our
construction
actions
of
and
roads.
statements should not confirm the fact that we are agents of development.
I'm saying
if
that
we are not.
we are seen as agents of development, although our constitutional mandate is to enact laws. But we are seen as agents of development. Therefore, we take up that extra role. Mr. Speaker, when we are campaigning, do we even talk about lawmaking? When we are campaigning, we don't tell the people, I'm going to make laws for you. We tell them that we'll bring development to you. That is what we tell the people. It's a fact.
Thank you very much, Honorable Minister. You may wind up.
Thank you, Mr. Speaker. Mr. Speaker, let me use this opportunity to thank my colleagues for their various contributions. Mr. Speaker, as I thank them for the contributions they have made, let me put on record that a lot of misinformation has gone into the hazards, and I need to correct same. Mr. Speaker, we in the Ministry of Health have not revoked any health workers' appointment. Mr. Speaker, and they are part of the ministry, please. They fall under the Ministry of Health. So we, in the Ministry of Health,
Honorable Minister, please address the chair.
Very well, Mr. Speaker. Mr. Speaker, whether Ghana Health Service or any agency under the Health Ministry have not revoked anybody's appointment. Mr. Speaker, I therefore put it on record that any health professional who has gone through the right processes, who is covered by the clearance, which ended on 31st December 2024, and has been posted, will never be sacked. And this is a house of record. Mr. Speaker, I was exceedingly surprised when my own good friend, the minority leader, was trying hard to link the cholera outbreak with change of government. For his information, Mr. Speaker, we started recording cases in cholera as far back in October 2024. Mr. Speaker, yes, that is the records. If you don't know, please keep quiet. That is the records. Mr. Speaker, in 2024, Mr. Speaker, in 2024, in October, DCEs and MCEs were at post. But we recorded cases. And so let us not try to politicize the disease. Mr. Speaker, again, Mr. Speaker, Mr. Speaker, he also made.
Honorable members, can we have some order?
Mr. Speaker, he also sought to clarify whether or why a FUTU has delayed in the vaccination. Mr. Speaker, the practice is that we have a certain threshold that if you get there, we then put in the request for vaccination. Although FUTU has recorded, cases in the recent times, they go there very late. And so as and when you get there, then we put in the application. We cannot use vaccination for one area for other areas. And therefore, I can assure you that by the end of next week, we may get consignment for a FUTU. Mr. Speaker, Mr. Speaker, based on the deliberations on the floor of the House, we have all agreed that cholera is sanitation and water problems, and we all need to come on board to fight against any kind of outbreak in this country. I thank you for the opportunity.
Honorable members, let me add my voice in extending our appreciation to the minister responsible for health, for coming timeously to brief the House on the outbreak of meningitis and cholera. So, Honorable Minister, thank you so much for coming to brief the House. Honorable members, statement time. Honorable members, we have admitted statements in the name of Duko Foriata, Honorable Member for Fantiakwa South, on sustainable funding for outbreak and pandemics. Honorable Member, you have the floor.
Mr. Speaker, thank you for the opportunity. This is my maiden statement in the House. The subject matter is sustainable funding for outbreaks and pandemics, which is the becoming of a national disaster. Mr. Speaker, recently we have had the discussion on this floor about outbreaks and pandemics beginning in January 2025. With the
Second Deputy Speaker to take the chair.
With a specific reference to HMPV. The issue was first raised by our colleague, the Honourable Member for Suhum. Mr. Speaker, there is a next step or position that we as a nation must take to make sure our safety, protection, and safety of our people is a reality. Mr. Speaker, the Ghana Health Service, along with the National Vaccine Institute, earlier last year and into this year, gave us assurances on the state of affairs of outbreaks and pandemics in Ghana. They have been very vigilant in doing this. In their lingua, they assured us that no unusual pathogen were in any reports from the screening scheduled across the 16 regions. We are grateful for their work. Mr. Speaker, the Minister for Health in the House today has reported one case of HMPV in Ghana. Mr. Speaker, the need to reassess our position as a nation on how we prepare for such matters, whether as an outbreak or a pandemic, is key. How prepared are we if there were an outbreak or pandemic of any other sort anywhere in the country? How prepared are we in research, human resource, appropriate facilities, adequate and appropriate vaccines, their supply, and most importantly, the financing? How prepared are we for education and awareness of the public? Mr. Speaker, the solution, therefore, must be in the front burner of this August House. We must support the initiative to be prepared to prevent outbreaks and pandemics and to protect the Ghanaian people at all times. To do so, we must have a funding stream for it. We must not wait till something happens, only then to scramble for financing with cap in hands as we do. Mr. Speaker, the solution is a dedicated fund to this cause, especially so in the absence of US aid funding, which was greatly beneficial to the health sector. The purpose of the new fund would be: 1, maintain financial support for disease and virus prevention activities by the Ghana Health Service, the National Vaccine Institute, and other related agencies. 2, ensure year-round preparation for prevention and combating outbreaks and pandemics identified by Ghana Health Service and its related agencies. And 3, to assure and ensure continued research into the prevention mechanisms, including education and awareness and vaccine manufacturing. Mr. Speaker, our responsibility as lawmakers and representatives of the people, especially those of Fantiakwa South, is first and foremost to ensure their well-being and safety. That is why they have employed us to this august house. Mr. Speaker, the nation must be ahead in matters of this nature at all times. Mr. Speaker, I'd like to thank you for the opportunity. Thank you.
But you are not here yet.
Very well. Honourable members, our brother from Fantiakwa South, is it South? Yes, has raised a very fundamental issue regarding funding. So we are it is now time for comments on the statement. Yes, Honourable Member for Suhum.
Thank you, Mr. Speaker, and I rise to comment on the maker of the statement. I think that on the 21st of January, I raised a statement on HMPV, and I rise to support the statement that has been made by the Honourable Member for Fantiakwa South, that the state should have alternative source of funding to be able to curb some of these diseases. Thank you, Mr. Speaker.
Thank you very much. Yes. Yes, Honourable Member for.
Thank you, Mr. Speaker, for the opportunity to contribute to the statement ably made by my colleague on the setting up of an emergency health fund. Mr. Speaker, one indication on how we are prepared to take up emergencies in this country is what my colleague is suggesting. The good thing is that we are aware that emergencies will always come, but we never know when the emergencies will come. And as a country, we do not have any source of funding to fall on other than the consolidated fund to deal with emergencies. The call for the setting up of an emergency fund hasn't started today. I do recall that there was an opportunity in this House when we suggested that the COVID levy that was placed on Ghanaians, we should think about an opportunity to change the COVID levy into a fund so that would be used to finance emergencies in this country. That will be used to finance emergencies in this country. The call hasn't been heeded to. But I think that once a colleague has raised this matter again, I think that we have to go back to the drawing board and look at how we are going to set up a fund. Several of these.
You're welcome back, and many thanks for staying with us. Just gone by was the Minister of Health giving update to the House of Parliament on update on the cholera and meningitis outbreak. The minister gave the assurance that the government was on top of its games and it remains committed to tackling the issue. Also, you heard reactions from some members of Parliament also on the issue. We now continue with regular programming. Please do stay with us.